Today is AML World Awareness Day, and I wanted to talk about why awareness is important to me. In November 2017, my husband Rob was diagnosed with acute myeloid leukemia. The diagnosis pretty much came out of nowhere. He was a healthy, active, fit, and trim 42-year-old man who played tennis and paddle a couple of times a week. And over the course of probably 2 weeks, he hadn't been feeling well and was having some strange symptoms, pains in his side and in his legs. He ended up going to the emergency room one evening because he was feeling so badly. And a few hours later, they had diagnosed him with leukemia, and he was taken by ambulance to Yale Hospital to see a specialist. Our lives were drastically changed in an instant. Rob and I knew nothing about leukemia. He was diagnosed with chronic myeloid leukemia and blast crisis, which behaves and presents similarly to acute myeloid leukemia, or AML. I think because we heard chronic myeloid leukemia, we thought he was going to be okay, because so far as leukemias go, according to Google, that is a better one to have. But what we didn't realize was that the blast crisis phase made it a completely different beast, and the doctors basically treated it like AML. My husband fought hard, and the doctors tried to bring him into remission, even if a temporary one, so that he could proceed to a stem cell transplant. But the cancer cells, or blasts as they call them, came back. His diagnosis at that point was relapsed or refractory AML. And while my husband was back in the hospital to get his blast count down again, he suffered a brain bleed and was put on life support. We decided shortly thereafter to take him off of life support, and it was just 4 months after his initial diagnosis that he passed. It's important to me to bring awareness to AML because while only about 20,000 people a year are diagnosed with AML, which makes up about 1% of all new cancer cases, AML has a very poor prognosis. It is a very aggressive cancer, and the 5-year survival rate is only 30%, and that varies depending on your age. So there is so much work to be done on improving the outcomes in this disease. Our AML experience was very short, and I was left in a state of utter shock with many more questions than answers. I found myself hearing about more and more people that had AML. It seemed to all of a sudden not be such a rare disease now that my husband had died from it. Part of my grief process was learning more about the disease and realizing that I had a desire to help others with my experience. When you are diagnosed with AML, your world is turned upside down in an instant, and you and your caregiver often have to make very quick, important decisions along with your doctor about treatment. It can be very overwhelming and can leave you feeling very sad, scared, and alone. I think the most important part of building awareness is helping people realize that there are others out there who are facing the same diagnosis and realizing that you are not alone as a patient or as a caregiver, and that can be very comforting. I think it is important for people to realize that there is an AML community that can be of support. The other reason I think awareness is important is other factors that are a crucial part of treating AML, like blood and platelet donations and signing up to be a bone marrow donor in the bone marrow registry. A part of the treatment for AML is often intensive chemotherapy and/or oral chemotherapy, which can bring down all of your blood counts. AML patients receive blood and platelet infusions often in order to keep their blood and platelet counts at acceptable levels. I think people who do not live in a world with a cancer patient may not realize how critical donating blood and platelets are. Becoming a bone marrow donor is not a difficult process. All you have to do is swab your cheek and send it in, and you can be entered into a database. The process of donating your marrow is not an invasive process like it used to be. A bone marrow transplant or stem cell transplant may be an AML patient's only option. I think by bringing awareness to AML, We can also bring awareness to these other critical parts of treatment that everyone can take part in. People often would ask, what can I do to help? And if there wasn't something specific we needed, I would say go donate blood or platelets. And it is a nice way for the family or the community to feel involved and rally around someone. Since my husband passed in 2018, there have been about 9 drugs introduced to help fight AML. So while a lot of progress has been made, my hope is that by bringing more awareness to AML, that the research and progress will continue and we will see great strides in the treatment and outcomes of AML.